When exercising and training any muscle, you should first consider which movements the muscle is involved in. For example, let's examine this using the hip joint. Some joints allow for only two basic movements. For instance, take the elbow joint. Its movements are simple, bending and straightening. But some joints, like the shoulder joint, allow for a greater range of motion. In addition to bending and straightening, the shoulder can perform abduction, adduction, and rotation. But for simplicity, let's focus on the basics. We'll consider 4 types of movement. These are flexion, extension, abduction, and adduction. Abduction and adduction, for example, apply to movements of both the arms and legs. Now, let's break this down using the hip joint as an example. The muscles responsible for abduction and adduction create movements to the side. Abduction moves a limb away from the torso, while adduction moves it closer to the torso. A similar process occurs in the hip joint, where a group of muscles, primarily the gluteus medius, is responsible for abducting the leg to the side. This muscle moves the leg outward to the side. When the leg moves back inward, it is brought by the opposing muscles. These muscles return the leg to its starting position. They are known as the adductor muscles. Here is a group of adductor muscles. To begin, let's refer to them as the primary muscles for this motion. They operate within a single plane of movement, the frontal plane. These 2 muscle groups facilitate joint movement within this plane. The next group of muscles in the hip joint is responsible for a movement known as flexion and extension, which, although it may seem unexpected, is the correct term for this motion. In simpler terms, this refers to the backward movement, retraction of the leg, while the forward movement of the leg can be described in the same way. Biomechanically, these are referred to as flexion and extension. When the leg moves backward, the gluteus maximus is the primary muscle involved. For forward movement, the opposing muscles take over. These include the iliopsoas and the rectus femoris, which is part of the quadriceps group. The quadriceps muscle plays a key role here. These muscle groups are antagonistic to one another. Antagonistic means they perform opposite actions. When the muscle on the opposite side contracts, this muscle should relax. For example, when the gluteus medius contracts to lift the leg to the side, its opposing muscle relaxes to facilitate this movement. This means that our gluteus medius muscle should contract and tense, while its antagonist, the adductor muscle group, should relax. Otherwise, if these muscles remain tense, the leg will not be able to lift freely. The same principle applies to the reverse motion. In reverse motion, the adductor muscles contract, and the gluteus medius muscle should relax. This pattern is consistent in such movements. For example, when the gluteus maximus contracts, the lumbar muscles and the rectus femoris should relax. Conversely, when the leg moves forward, the rectus femoris and lumbar muscles contract, while the gluteus maximus relaxes. This is the normal biomechanics of movement. In essence, when one muscle contracts, its counterpart relaxes. Problems arise when this sequence is disrupted. What are the possible scenarios for this disruption? For instance, the muscle responsible for the movement, such as lifting the leg to the side, might be weakened. Specifically, the gluteus medius muscle could be too weak to perform this action. But if you still need to lift your leg, the movement may no longer be performed by the gluteus medius. Instead, it might involve the entire pelvis rather than originating from the joint, relying on the compensatory action of other muscles we've discussed. The quadriceps, for example, might assist by altering the position of the pelvis, enabling the leg to lift. This compensation often masks the issue because the movement appears functional. Not everyone notices subtle changes in their gait or movements, though some may recognize that something feels off. If the gluteus medius is inactive, the pelvis compensates by rotating to the side instead of the muscle performing its role. This is one type of dysfunction. In other words, the first group consists of the muscles responsible for performing the movement itself. The muscle responsible for the movement is called the agonist, while its counterpart, which performs the opposite movement, is the antagonist. These muscles act as antagonists to each other. This describes the first scenario. The agonist muscle is weak, causing dysfunction. In this case, compensatory muscles take over its function. While this adaptation works temporarily, over time it can lead to pain and other issues. Interestingly, the weakened gluteus medius muscle itself is unlikely to hurt. Instead, the compensatory muscles, which are overworked, will experience strain. Additionally, the hip joint may become inflamed due to instability caused by the lack of gluteus medius function. Another scenario occurs when the gluteus medius contracts normally to lift the leg to the side, but the opposing muscles fail to relax. In this case, the adductor muscles maintain their tension instead of relaxing. This results in restricted movement in the hip joint and can cause similar problems to those in the first scenario. To increase the range of motion, other muscles may also be involved, though to a lesser extent than in the first scenario. These include the oblique abdominal muscles, the internal obliques, the lumbar muscles, and the quadratus lumborum. This represents the second possible scenario. The third scenario to consider during muscle training occurs when both the agonist and antagonist muscles are weak. In this case, both the muscle responsible for the movement and its opposing muscle lack strength. As a result, additional muscles step in to compensate for the weakness. These compensating muscles, such as those that lift the pelvis and produce similar movements, become involved. However, this leads to joint instability, which develops quickly due to the weakness of both the primary and opposing muscles. Additionally, the flexor and extensor muscles may also weaken over time. Joint instability often causes capsule injuries in the joint, which then reflexively weaken nearby muscles. This is frequently observed in athletes or individuals who attempt splits or engage in stretching exercises. If we examine the muscles involved in performing transverse or longitudinal splits, we find that two primary muscle groups are engaged. These are the gluteus medius muscle and the adductor muscle group. For simplicity, we won't distinguish individual muscles within these groups for now, but will refer to them as a single large muscle group. While the adductor group consists of several distinct muscles, it's sufficient to understand that they function together as one major group. The antagonists to the adductor muscles are the gluteus medius muscles. Typically, When training to achieve a cross-legged split, the focus is on stretching the adductor muscle group. But this is often done incorrectly or unsuccessfully. For example, after such exercises, individuals may experience pain or discomfort in the sacroiliac joint area. Why does this happen? It's because there needs to be a balance between the gluteus medius muscle and the adductor muscle group. If the gluteus medius muscle is weak from the start, the adductor muscles will tend to shorten with every step. This is one potential issue. The second issue involves their interconnectedness. In addition to the mutual influence between these two antagonists, there is also a connection between them and other muscle groups. Specifically, this involves the muscles responsible for movements in the frontal plane and those facilitating forward and backward movements in the joint. Normally, moving the leg forward is the responsibility of the rectus femoris, part of the quadriceps muscle group. But if this muscle isn't functioning properly, for instance, if it stops working due to trauma to the knee, an injury to the muscle itself, a nerve disorder, or nerve root compression, such as compression of the sciatic nerve near the hip joint or ligaments, problems arise. There are many reasons why the quadriceps muscle may become inactive. But since walking requires moving the leg forward with each step, the body compensates. Nearby muscles take over the workload. This alters the joint's movement angle. At the same time, it causes continuous strain and shortening of the compensating muscles. As a result, someone might stretch the muscle, seemingly improving flexibility. But after walking even briefly and trying again, it feels as though no progress was made. They end up needing to repeat the same stretches daily. Over time, the muscles seem to shorten again and again. There are usually two main reasons for this. Either weakness in the antagonist of the gluteus medius muscle, or weakness in the rectus femoris. The most problematic scenario arises when you begin these exercises with pre-existing weakness in the adductor muscles. The adductor group consists of several muscles, each of which should have adequate tone. Sometimes one muscle is weak, or all of them may be weak. Stretching a weak muscle often results in injury, further exacerbating the weakness. This creates additional challenges, such as difficulty performing splits. What begins as a muscle issue can escalate to joint problems. The femoral head may shift closer to the joint surface, causing improper alignment. To ensure that these exercises do not cause harm, but instead help restore muscle function, reduce joint strain, and improve overall performance, it is crucial to consider these factors. This applies not only to exercises like transverse splits, but to any muscle-focused exercises. Maintaining balance is essential, as imbalances often lead to problems. For example, someone with a forward-leaning posture often experiences constant tension and pain in the neck and upper spine. He develops a compulsive urge to stretch constantly, driven by the tension in the overstretched ligaments, which are struggling to support the spine with their remaining strength. Feeling the ligament tension leads to an increased urge to stretch. Unfortunately, this further weakens the already strained flexor muscles. This highlights an important principle. Things are not always as they seem. Many believe their body instinctively signals what needs to be done. This is not always the case. Often, these are false perceptions that lead to poor outcomes. Therefore, it's essential to keep this in mind when performing exercises, especially stretching exercises. Strength exercises for muscles, on the other hand, generally do not carry the same risks. There is less risk of something going wrong. Stretching, on the other hand, can easily go wrong, triggering a pathological cascade of reactions that, unfortunately, may do more harm than good.